Did you know that just being 20% weaker on your surgical leg can increase your re-injury risk by 30% after ACL surgery? That's huge. And the crazy part is, most people end up there because they're missing this one simple training tool that tells you if your exercises are actually hard enough to rebuild strength. The repetitions in reserve scale, or RIR scale for short. People often work hard for months but are left frustrated with lingering pain and weakness. Getting quad strength back means getting back to hiking, skiing, and playing sports as safely and as efficiently as possible. In this video, I'm going to be breaking down the RIR scale and how you can use it to help with your knee recovery. In a nutshell, the RIR scale is a way to quantify how hard you were working during a strength training set by the proximity or closeness that you were to true failure. Why is it important that our strength training sets are within a few reps of failure? Because that is what produces the stimulus and the signal for our body to build muscle and to get stronger. Now, there are a few caveats here. The weights used during your sets matter a lot. The weights used will also dictate the repetition ranges that you will be able to actually do, which also matter. So let's take this example. If I was doing bicep curls with a pencil, I could probably do hundreds of reps before I even get close to failure because the weight is just so light. Now, just because I take my pencil curls to failure a few times per week doesn't mean my muscles will actually get stronger. The weight is just simply too light to create any change. Now, weight used is always relative. 100 pounds can be heavy to person A, but can be relatively light to person B. Someone who's within the first 2 months after surgery will also not be able to lift the same weights as someone who is 8 months down the line, for example. Now you might be thinking, John, I'm not lifting heavy weights for low reps in my first month after surgery, and you're totally right. Strength training will look different at each phase of rehab. The physical fitness of the person, the stage of healing that they're in, the pain, their swelling, what their program has built them up to, all matter, right? So while the weights, reps, sets, and exercises will vary, the principles will remain the same throughout the course of rehab. And this is where the RIR scale comes into play. This scale is used to quantify how many reps you had left in the tank at the end of a strength training set. This is another way of saying, when I stop a strength training set, how many more reps do I think I could have done if I tried as hard as possible? So let's say I do a set of hamstring curls with 100 pounds for 10 reps, and then I go for the 11th rep. I try super hard, but I can't quite get a full rep. This would be an RIR of 0, aka failure. I couldn't do another rep if I tried my hardest. Now, if I stopped the set at 9 reps, that would be an RIR of 1. 8 reps would be an RIR of 2, so on and so forth. So let's take a look at this example of the RIR scale in action here. You can see I'm putting in a ton of effort and my rep speed starts to slow down. Here's an RIR of 3, then we have an RIR of 2, here's an RIR of 1, and finally we have an RIR of 0, aka true failure. Generally speaking, we want our strength training work to be at an RIR of 3 or less to ensure that our sets are difficult enough. Remember, your muscles won't change, grow, and get stronger if they have no reason to. One of the biggest mistakes I see over and over again is what I call the 3 sets of 10 forever trap. When clients join my program, I always ask about their previous rehab plans. What's the most common answer? I was doing 3 sets of 10 for everything, or something along those lines. Now, there's nothing inherently wrong with 3 sets of 10, but here's the issue. When I ask how much rest they were taking in between those sets, I usually hear one of two things. 1, I basically just do all 30 reps in a row, or 2, I take 10 to 20 seconds between sets. In either case, that isn't 3 challenging sets, it's basically one long, easy set of 30. And with the exception of those really early stages after surgery, the weight used just isn't heavy enough to actually get them stronger. And the weight is so light that you could keep going for 10 plus more reps. Your RIR is sky high. Way too easy to ever stimulate strength gains. Now again, there's nothing inherently wrong with 3 sets of 10 if those sets are pushed hard enough, around an RIR of 3 or less, and progressively loaded as you get stronger. But doing 3 sets of 10 with no progression is exactly why so many ACL rehabs stall out and leave people weak months later. If this video opened your eyes about how hard you actually need to work in ACL rehab, hit that like button so more ACL patients can see this, and subscribe for weekly strategies to get your knee and your confidence back. And listen, if you're putting in the effort, but your strength just isn't coming along, don't waste another month spinning your wheels. Book a free call with me through the link in the description. We'll review what you've been doing, spot what's holding you back, and build a clear game plan to get your strength and mobility where they need to be. You've worked too hard to stay stuck. Let's get you back to doing what you love. I'll see you on the next video.